Hi everyone, welcome to our video on mental health and substance use in elementary schools. So my name is Anupama Varghese. Today I have the pleasure of speaking with Ratsindu. She is working as a teacher. So welcome Ratsindu. Thank you Anupama. Today we would like to talk about the mental health and substance use in elementary school. Actually, mental health play a very important role in elementary school. How they cope with the mental health as an elementary student. So we have a lot of questions and I will answer you a lot of things about the mental health and substance use. So, from your perspective, what does mental health mean in an elementary school setting? So I think mental health in elementary school means supporting children emotionally, socially and psychologically, not just academically. It's about helping students build self-esteem, manage emotions, form relationship and feel safe and supported. Mental wellness is a key to a student's ability to learn and thrive both inside as well as outside the classroom. In your experience, what are some of the most common mental health challenges faced by the kids? So I share one of the experience. I had a student who began showing sudden outbursts and aggressive behavior in class, like he is throwing objects, yelling, and refusing to follow instruction. At first, it seemed like defiance, but I realized it was more than that. I stayed calm, ensured safety, and spoke with him one on one when he had cooled down. I brought in the support of our children and youth worker and contacted his guardian. I turned out he was struggling with anxiety and things at home, and with a routine, quiet breaks, and team support, his behavior improved. It taught me that aggressive behavior is often a sign of something deeper. As a teacher, how do you support students who are struggling with this kind of mental health issues? So I support the students who face the mental health problems in the elementary school. So first of all, I build a trusting relationship with them and provide the safe environment to the elementary students that they are open up with me and share their problems with me in a very easily way. So I also try to reach to their families that if they face any problem in the school or as well as their homes, so I try to solve that kind of problems. Additionally, I also seek the help from the other teachers who teach the elementary students, and also from the social workers who provide the care to the elementary students, and because they know a lot of things about the mental health of the elementary students. What type of behavioral issues that you see in your classroom and how you approach these kinds of issues? So I see a range of behaviors. Some students are struggle with focus and are easily distracted, while other might be act out with aggression. And I also notice that withdrawal, frequent complaints of feeling sick, or kids who are overly clinging. These behavior are often sign of something deeper like anxiety, trauma, or stress at home. My approach is to stay calm and curious. I try to understand what behavior is communicating and support the students through positive reinforcement, structured routines, and referrals to our school sport team when needed. Why do you think it's important to talk about mental health and substance use to the children at the younger stage? It is very important to talk to the students about the mental health in their young age, because it normalizes the conversation and help kids understand their emotions. When we talk about mental health early on, we teach kids that it's okay to ask for help. It builds emotional intelligence and reduce the stigma that often prevent people from getting the help they need later in life. What strategies or classroom activity have you found helpful in promoting positive mental health among the young students? So there are a number of strategies and activities that help the students who are struggling with the mental health. I use emotional check-ins, calming routines like breathing, exercise, and social Social emotional learning activities. We have a calm corner where students can go when they need to self regulate. Group sharing circles also work well. They give kids a voice and help them feel connected. These simple practices go a long way.
Have you noticed any impact in social media or phone screen use on the children?
So, social media and screen use put a great impact on the mental health of the students. Even though most elementary students are not supposed to be on social media, many are using platforms like YouTube, TikTok, or even gaming chats. I see more comparison, attention difficulty, emotional overstimulation. It can affect their mood and even their sleep. Teaching digital citizenship and healthy teach habits is becoming more important than ever.
How does a parent or caregiver's addiction or substance use affect their children in their well-being?
I think parents or the caregivers of the sons put a great impact on the behavior of the students. It can have a big impact. Children living with parent addiction may come to school stressed or tired. Some people be a hyper vigilant or withdraw. They might struggle with trust or act out because they do not feel safe. As a teacher, I try to provide structure, consistency, or emotional support, and I work closely with our school sports staff to ensure the child get the help they need.